My name is Derek. I work at National Institutes of Health, better known as NIH. I gathered my master's in public health with a concentration in social behavioral sciences, and I acquired that in 2018, which seems like eons ago at this point. In my current role, I work very closely with the community. Um, I work in a rare disease, so it's a very small, close-knit community, and we're trying to get FDA approval for treatments for them because currently there are none. So working very closely with the community, rather it's the patients, the families, or other organizations. We ultimately work to the same goal of trying to see how this extremely rare disease, how it naturally progresses, and how we can find a treatment for that to either slow it or even stop it. Study abroad program, which I definitely took a part of, where we stayed in London for about a month. We worked closely with the health department. Overall, the program, like I said, was about a month long, really focused on HIV and infectious diseases. So we learned on that how they handle things in the UK, and it definitely added and expanded my knowledge on how things work out internationally, rather than having kind of like a microscope view on the US. The bulk of my work that I pulled from my master's degree, I probably would say statistics and drafting papers. So, working with SPSS, which we did a lot of, and also Stata, definitely helped me to kind of catapult and make me be able to know what I'm doing on how to run numbers, which, like I said, I currently do. When I was looking at master's programs, there was between NYU, Columbia, and Rutgers. Unfortunately, I felt that the curriculum at Rutgers and also Columbia was too rigid for me on what I wanted to do. GPH, it offered the global aspect, which is what I was looking for. Studying abroad definitely helped me kind of grasp the bigger picture on the global level, as opposed to the other programs I looked at the time, just didn't offer that flexibility. Undergrad year, I took a research 101 class. I enjoyed it. When I graduated, I actually acquired a job at NYU Langone Medical Center, where I worked at a research site where we basically created the site. We took all our information and our resources that in New York City, and we took it down to a military base in Kentucky. And there we basically created it from scratch. And seeing that process, it ignited my passion for research. I'm like, okay, I actually like doing this. I saw how it could benefit the soldiers that we were kind of getting assessments from, getting information slash data from, and then kind of transition into my current role. Ultimately, I guess you can say NYU Langone. Statistics, I guess you can say. Although it's not like my favorite thing to do, it definitely is it's a major aspect and key role for research, and it's definitely a needed. Aside from what I did, social behavioral sciences, I definitely recommend statistics just because you can utilize that even outside of health. I find the motivation in seeing the process and the end result, and seeing how it benefits the families and the patients, and seeing how it can improve the quality of life ultimately and prolong life.